Trauma can be as little as somebody that falls down and cuts their head and they cut it so badly that they have a critical injury, or it can be that car accident.
Trauma can happen to so many people. It really can happen to any of us. There's no demographic.
The first phase of our care is reaction just to what we encounter. And then we really want to get into a position where we're responding to what the person needs.
The care that's delivered at the scene is extremely important, and even though we're at the hospital, we are really partnering with EMS agencies.
Really, we're just an extension of the emergency department right out to the front door of the patient.
We have a saying in trauma, so you want to get the right patient to the right center at the right time. So time is of an essence for our sickest patients.
If we pick you up in Alexandria and we bring you to Alamere, or we pick you up in Brainerd and we bring you to Lakewood Health and Staples, it's here's what we saw, here's the work that we did, here's the medications we gave, and these were the results.
Patients often will go from the scene to another hospital where they're providing some life-saving care prior to transfer, or they'll come straight to us.
Patient lands in the emergency department where the decision is made whether they need to go to the OR, if they just need to go to ICU. That's ultimately made by our trauma service providers.
Being able to diagnose things now at the bedside that previously would have taken tens of minutes, if not hours, is very impressive.
My team is really, really good at stabilizing patients. They're really good at thinking on their feet, working as a team. It's amazing how fast this team can come together.
The emergency department is certainly vital, and we really enjoy working with our trauma colleagues in a team aspect.
The way that we define the trauma patient is from the time that they're injured until they go home. Trauma is actually a very systematic way of providing surgical care to an injured patient.
It should really look like a pit crew for NASCAR. I mean, everyone is in the same position, has the same job every time.
Choosing to have the administrative and medical staff commitment to be a Level 1 trauma center tells the community that you're committed to providing that emergent readiness care that is always ready to take care of any injury.
The lessons that we learn from that work, we're obligated to write about it. You got to write about it, study it, and publish it. And so to be a Level 1 trauma center, you have to have core commitments to research and education, as well as the high-level trauma care that we provide.
When I go to national conferences or read kind of best practices, a lot of it's old news for us. We've been doing that for a period of time that makes it seem like I can't believe that this is considered cutting edge. We've been doing it for years.
At our highest level of activations, we are taking care of about 900 to 1,000 activations a year. So sometimes that means we could have 10 activations in one day, and sometimes that means we could have 2.
Our next challenge is how do we evolve to EMS 3.0, improving the access, improving the equity of care that we're providing, improving the excellence of the clinicians and the tools that they have.
And supporting that mission through education, through simulation, through training, supports the next advancement and the next care and the next person.
For us to be here 7 days a week, 24 hours a day, 365 days a year, it takes a lot of people. It takes a big team, and you've got to train that team. And to do that takes time, money, resources, and dedication.
I think investing in trauma care is extremely important, and I think that if people ever are going to be worried about their family and their family member coming in as a trauma, I think you want to support the people that are going to be taking care of that person and give them any resources they can to be as well trained as possible to care for your loved one.